It's a pleasure to be here, and I am looking forward to talking about one of my favorite projects, antibiotic resistance in Indiana. There we go. I'm sure you're all familiar with antibiotics. We have them in our lives all the time. We've got cephalosporins, penicillins, amoxicillin, augmentin, cipro, fluoroquinolones, macrolides, azithromycin, which is in your Z-packs that you may get, tetracyclines. We've come to rely on them. They've saved lives starting in the late 1930s through the 1940s. Many of our soldiers in World War II were saved by the introduction of penicillin. We've taken them for granted, but we've got resistance. It's become a critical global issue. Yearly data in the United States that's been compiled by the CDC says that more than 2 million people a year acquire serious infections due to antibiotic resistance. At least 23,000 people die a year. What is antibiotic resistance? Well, it's the ability of bacteria to resist the effects of an antibiotic. But the bacteria change when they're challenged with antibiotics. They reduce the antibiotic effectiveness, and the bacteria can survive and then continue to multiply and cause infection. The CDC says that antibiotic resistance has been called one of the world's most pressing public health problems. They say resistance anywhere is resistance everywhere. What that means is that we're a global society. If you have a resistant infection, you may transmit it on an airplane and take it to someplace else, another continent. You've got to worry about resistance once it occurs anyplace. So the Biotechnology antibiotic research team has focused primarily on antibiotic resistance in gram-negative bacteria. These are things like E. coli and Klebsiella, organisms that we see all the time. We particularly looked at the Carbapenem-Resistant Enterobacteriaceae. Carbapenems are beta-lactam antibiotics that have the highest potency against the largest number of bacterial species. However, if carbapenems lose their effectiveness, many other drugs also are no longer effective because the resistance that causes carbapenem ineffectiveness, resistance factors are carried on the same mobile elements as other resistance factors for other classes of antibiotics. Because of this, we see mortality as high as 70% in some hospitals. Well, we got involved with CREs as the result of Jerry Denny's, who is the head of the IU Pathology Laboratory in Indianapolis. He services 12 Indianapolis healthcare centers. He collected CRE isolates for us. My students over the period of 5 years have looked at 185 antibiotic-resistant isolates. We've looked at PCR reactions. We've done gene sequencing. We've identified resistance genes that confer resistance to the carbapenems. And we've tried to figure out how they might be transferred among different patients. As a result, Dr. Denny's has been working with several of the IU health centers, several of the Indianapolis hospitals, notified them that they had some problems with transferable resistances within a specific hospital. So the hospitals instituted infection control practices. The results that we see here show the number of isolates per month that he was getting in 2009 and 2010 when we began our studies. You can see through 2013 the number of isolates have increased, but not only that, if you look at carbapenem-resistant isolates, here we have a doubling from 2010 to 2011, up another percent in 2012. Infection control started to be instituted during this particular time period. In 2013, we were down to 1.4% of the isolates. So we have a feeling that perhaps what we're doing had some kind of effect. In addition to strict infection control in the hospitals, there are other solutions to antibiotic resistance, and that's by developing new antibiotics. One of the other activities of my lab is to test some of the newer antibiotics that are being developed to treat these infections. We've tested 4 beta-lactamase inhibitor combinations that kill organisms, including CRE. We've got 2 publications on the drugs called Zerbaxa, which was recently approved by the FDA in December of last year, and ceftazidime-avibactam, which was approved by an FDA advisory committee but doesn't have full FDA approval yet. We have plans to test a new tetracycline that's in late-stage clinical trials and a new aminoglycoside. So we've got 3 different classes of antibiotics, 3 different kinds of resistance mechanisms. These all are going to have some activity against CRE. So I'd like to thank the students who have worked on these projects. These are the students from the last 2 years, and I thank you.